I wanted to follow on just a little bit with Senator Kane when we're talking about workforce, where we're going to get these great people from. One of the programs that has been helpful for us in Alaska is through the National Health Service Corps. I haven't heard any of you mention that this morning. I'd be curious to know if you feel that we can be doing more with National Health Service Corps to help bolster our workforce. Ms. Pears Kelly.
So thank you so much for your understanding and your long history of support. And the National Health Service Corps could not be more important to health center workforce. So I think as we're talking about investing in the community health center program, we also have to think about programs like the National Health Service Corps, which enables them to staff up. And so if you're making the investment in health centers, you have to think about part of the access equation is that workforce. The National Health Service Corps has a decades-long record of success, both in terms of diversity, but also in retention in the areas where they're doing the training. And so there is a request for significant funding to at least keep intact what has been invested over the last couple of years through the rescue plan, which has been a huge enabling factor to making sure health centers have been able to bring in and retain the staff that they have. And so I cannot echo and emphasize enough the importance of the National Health Service Corps specifically. I'd also say the Teaching Health Center Graduate Medical Education Program as well. That is really what enables health centers to train up. And just getting at what you also mentioned, Senator, around where are these people coming from? There are so many individuals in the community who are poised and want to pursue a pathway within the health center, and it doesn't need to be just clinical. There's operations, there's technical, there's you name it, and health centers need it, every bit of it. And so I think the National Health Service Corps, the Teaching Health Center program, but also, frankly, giving health centers added investment to be able to innovate, to create these programs, to create homegrown opportunities for developing workforce is not just needed, but absolutely critical.
We're going to be working on that reauthorization.